morning. Our hearing will come to order. I want to welcome you to the Budget Subcommittee on Health and Human Services, number 1. This morning, we have a robust agenda of a number of human service items that have been addressed in the mid-year revise. We ask, as always, that our presenters be brief and provide us just a brief overview of the issue. We want to save the majority of the time for discussion and questions. We also will allow public comment on every item. Speakers will have 1 minute. If there is some issue that has not been fully addressed, as a result, I'm going to grant more time. But given the number of items that we have to cover today, the committee appreciates brevity and having our speakers come right to the point. With that, let us get underway with issue number 1. We will be discussing the continuum of care reform. We call to present the Department of Social Services. We recognize the director who's here and his team, and we are ready for your testimony whenever you are. Welcome.
Good morning, Chair Thurman, Committee. I'm Will Lightbourne, Director of the Department of Social Services. I'm joined by Pete Chervinka, our Program Deputy for Benefits and Services. I'm going to start with the continuum of care reform item, which of course is a major initiative. The May revision adds components and recalculates some components from governor's budget. It adds funding for the rates structure, which was not previously in the budget. It was acknowledged that they would be forthcoming, but this is where they now are being presented. These are rates both for resource family homes, and this provides for a rate structure that tiers according to the needs of the child. So whereas historically the process was blind as to the child's needs, this now allows for different rates to be established based on a child's needs. The process for ascertaining those needs is one that's still in development. We won't have a statewide assessment instrument in tested use on the ground for probably more than a year from now. Therefore, in the interim, we'll be using existing county assessment procedures that counties typically use when case plans are being developed for children, as well as the processes that they use to determine application of specialized care increments and other special supports. We expect that in most cases this will be occurring on a flow basis as the children come due for their semi-annual court reviews, and that then sets up the process for the child and family team to engage in a determination of children's needs. Are they changing, and how to correspond services to those needs. The budget also resets the estimates for the cost of child and family teaming in the child welfare and probation systems, and allows for child and family teaming in the behavioral health side of the system. The specific calculation as to sort of how many hours with what frequency, et cetera, candidly, I think honorable people can honorably see a different logical set of estimates. These that are presented in the budget are, I think, a sort of a fair and honestly budgeted approach. We don't have a long applied history of child-family teaming in our state. Those that we have had are more associated with children with significantly higher needs, i.e. the KDA subclass youth. So extrapolating to the needs of youth in all levels of care is approximate. We expect that as we have experience, we will be able to refine from approximate to make any changes in the future as needed. The budget also recasts the cost for counties to engage in foster parent retention, recruitment, and support services. Obviously, an underlying feature of CCR is the ability, particularly to engage relatives and to meet any immediate needs they may have in order for them to be able to care for children who would otherwise be in congregate care. And then also the budget provides for a rate that counties can utilize in order to extend services beyond the basic rates to those resource families, presumably largely relatives, so that the child's needs are being met in those settings rather than the child having to be moved to some other setting for services. On the resource family approval process, the budget is largely stable. I don't think in our dialogues with our partners and stakeholders, we didn't see any need for particular change there. One other area that is sort of worth noting in the budget change is the social worker rate that is being applied in the calculations. Let me just step back one moment to sort of Prop 30 and realignment. In 2011-2012, realignment occurred, which essentially transferred almost the entirety of the child welfare program and state funding from the state to the counties, and attached to it a growth fund that would presumably meet increased costs over time. Prop 30 requires that the state, if we add new services or activities or requirements, it requires us to fund those. Since the social worker rate has certainly increased over the years, instead of funding at the usual rate in the $70 range, the budget funds the increment of needed new services at an $85 an hour social worker estimate, and then we're committed to sort of truing up with actual claims data on that incremental marginal service on a going forward basis. Again, the 85 is a bit of an approximation. I think it serves as a reasonable starting place for the process. Those are sort of the major changes in the budget side. In terms of the questions that staff addressed to us in the staff report, the first is sort of the response of behavioral health services and provider community. There has been, we have various work groups that, state county work groups that focus on different aspects of CCR implementation, and one is specifically around mental health, behavioral health. I would characterize it as very collaborative, increasing engagement and refinement from the behavioral health side's understanding of what changes need to be occurring for CCR to be successful. As I mentioned, the May revision proposes some additional funding to support mental health involvement. The County Behavioral Health Directors Association presented some information last week around other assumptions and costs, and the administration is going to be working with them to refine those and make sure, see where they're based and how to reasonably accommodate. In terms of what it portends, I think there's a complete comprehension that this now is where the two systems start to mesh. In those counties where the two departments are essentially in one agency, they are very far along. I look at counties like San Bernardino, San Diego, et cetera. And even where they're not housed in the same organizational superstructure, I think there's a lot of recognition of what it's now going to take for that process. In terms of the county administrative process, what we're going to be doing over the next literally days and weeks is devising a claiming system that pre-identifies which are the activities associated with CCR that are being budgeted, and ties sort of back to that. So first we can see what is in fact being spent on those activities, and so we have clear baselines. Also, it will give us a sort of a fairly quick sense of, are there anything in our estimates that we need to reconsider? And thirdly, it'll give us the sort of the feedback as to implementation. Is it fully underway, and are the deliverables being achieved? Ultimately, the true-up is a cost and savings dynamic, which is not just a statewide function, it's a county-specific function. Prop 30 requires that each county be made whole for any changes on an individual basis. So that will be sort of starting in approximately 2 years, sort of an annual process that we are determining. Finally, the third question is, to what degree were the rates mitigated by constraints? Earlier I sort of said the estimation process is a science when we are counting the things that we do already. That's fairly mechanical. When we are estimating the things that we don't do already, then there's obviously projection, there's dialogue, there's a dynamic tension that sort of feeds into it. Overall, if I were to say that there are never an awareness of the total cost of an initiative, I would not be being truthful to you. But at the same time, I just want to sort of note that this is a full fiscal year $217 million general fund administration initiative. It's not something that is being approached on the cheap in any sense of the word. I honestly do not think there has been another social services initiative on any scale like this in California that was not federally required as the result of something like PROR or some major federal law change, as it being a state-initiated system improvement strategy to improve the services to kids. I think it is well-resourced. Ultimately, we fully expect that it will be more than justified by improved outcomes for the object of all this, which is the children. And ultimately, we expect that it will actually produce cost savings that are offsetting. But that has not driven the dynamic of how we've put together the estimates. So with that, let me stop and see if there are any specific questions that you have.
Thank you, Director Lightbourne. And this committee supports the goals of helping young people and keeping them out of group homes and providing for better care and supporting committed families. So the committee shares those outcomes. Let's get to the details of the proposal today. Is there anything from the Department of Finance? Anything from the LAO's office?
Good afternoon, Mr. Chair. Ben Johnson from the Legislative Analyst's Office. With the release of the May revision, the Governor has released what we consider more refined estimates of the costs of CCR implementation at both the county and the state level, proposing $127 million across all county and state departments and representing more than a $60 million increase over the January proposal. As Mr. Lightbourne noted, one major difference between the January and the May estimates is that the May estimates include the new rate structure by which caregivers and foster care providers will be paid, and the rates at which they will be paid. The structure of which is detailed in the agenda. Overall, we do believe these are more refined, but there are still uncertainties around what the costs will ultimately be and how it will ultimately work in practice. Rates here offer a useful example. We have yet to learn certain details of how the assessment process is going to determine what child a rate's received. And really, we can't know how that's going to work until after January 2017. So any estimates of what rate a child receives is really a projection going forward, which will change ultimately in practice. And then the importance is that what rates the child receives impacts what resources a foster family has access to, what services they have access to, and then the cost estimates. So in light of these uncertainties, around which rates are but one example, we believe that the legislature might consider what kinds of oversight it would like to put in place to oversee CCR implementation, believing that such oversight could, one, help ensure readiness on the part of DSS, counties, and foster care providers once CCR does go live, and two, to help ensure that CCR achieves the outcomes and objectives that Mr. Lightbourne laid out previously and that legislators envisioned. So, thank you.
Thank you. Any questions from committee members? We'll take public comment, but before we do, Madam Clerk, would you please establish the roll for the committee?
Chair Thurman?
Here.
Bonta?
Here.
Chu?
Here.
Grove? Harper?
Present.
Quorum.
Thank you. Public comment, 1 minute each.
Good morning, Mr. Chair. Tia Orr on behalf of the Service Employees International Union in representation of thousands of social workers on the grounds every day. We are happy about this measure and, of course, supported the policy last year. We've worked very closely with the administration in the last months to try to figure out the best investment and the necessary investment for this to work successfully. We are happy with the May revision and think we made a huge amount of progress, and our members are very excited about it. There's a couple of areas that I think we still fall a bit short, specifically in the child family teams. As you know, this is an integral part of the CCR for us to be able to get together and make the best decisions for the youth. The time that's spent on these cases is extreme, and I think we believe there's an underestimate of the time that we need on those cases based on the May revise. I'd also say that the rate structure, as mentioned, we need to put additional work into, figure out how it's going to work. This is obviously very important for recruitment. And then lastly, I'd like to mention the need of child care. When we go out to the field and we look at people that want to be foster parents, child care remains a big barrier for them. So thinking about that and thinking about tackling that could be a way that we get more foster parents to take these youth out of institutionalized care. Thank you.
Thank you.
Good morning. Mary Adair with the County Behavioral Health Directors Association. We want to thank the administration for working with us intensely over the past 6 months. However, we do have funding concerns. We appreciate the May revise additional funding for specialty mental health, but we remain far apart on some other assumptions. They're driven primarily by how many children are served and at what level intensity county mental health is involved. So we look forward to continuing to work with both DSS and DHCS in hammering out those issues. Thank you.
Thank you.
Mr. Chair, members, Carol Schroeder, the California Alliance of Child and Family Services. As you know, we've been strong supporters of CCR from day one. We've only had since Friday to take a look at the rates, and only had a chance this Monday to talk with our member agencies. So we still have a lot of questions about this. Right off the top, we would question the adequacy, particularly the FFA rates, and the amount for social services and support that's built in for that. We're concerned that it's not going to be sufficient to provide the necessary levels of that in order to assure the kids can step down from group home care into foster family agency care. We are concerned about the structure and the difference in the social service support rates between the various levels. The $44 difference between the level of care 2 and 3 is about the amount that it would cost to transport one child one time half in one direction between her grandmother's house in Oakland to her school of origin in Antioch in order to meet those requirements. We're also concerned about the level of funding for social workers, and the FFA continues to be inadequate. We look forward to continuing to work with the department on these issues and getting a little bit more information on the structure and the amount and coming to some agreement on that.
Thank you.
Good morning, Beverly Johnson. I'm Chief Program Officer with Lilliput, and we've served on the CCR stakeholders meetings, et cetera. I want to speak on behalf of Lilliput, but on behalf of the thousands of caregivers that we serve on a yearly basis. And, in part, the importance that relatives often don't know and request the needs and services that they really need. We support the direction that the administration is taking in terms of parity for relatives, but we also think that we need to take another look at the rates and the rate structure in terms of adequately supporting these caregivers. These kids have the same mental health needs. There's different levels of care that they need, and so we just support a more deeper dive in terms of the rates and what they will adequately support relative caregivers. So thank you.
Thank you.
Good morning, Angie Schwartz with the Alliance for Children's Rights. And when we started the CCR process 4 years ago, we were looking at the continuum of rate-setting placements and how to make sure that all families can be supported. And this proposal this year is the first time in California's history that there's a proposal on the table to actually equitably support all families and make sure that kin are included squarely and equally in the new home-based family care rates that are being proposed. So I really applaud the department for creating the structure that we can build upon to make sure all families have the support they need. I think we do need to do a deeper dive into making sure that the supports and services funding is also similarly child-centered, that children can get supports and services regardless of placement as well, and that we're not requiring them to be connected to an FFA in order to get those supports and services, which is how it's in the revise right now. And I really applaud staff comments on developing a process where we can continuously look at these rates going forward and make sure the rates themselves are adequate to meet the needs of kids. Thank you.
Thank you.
Thank you, Mr. Chair. Frank Mecca, Executive of the County Welfare Directors Association. Strong supporters of CCR. In fact, our staff co-chaired the original working group that sort of launched the ship. And so we'd like to thank the administration for intense work with us since the last time you heard this. There's been a significant increase in the investment over the January budget for the administrative and social work activity that's critical for the success of CCR. Compromises were made all the way around. The administration increased their level of investment, and the counties brought down our request from what was optimal to achieve the best results for kids. We got very close, but we do have a request to the committee that I won't sort of go into detail, but it will be coming to you in writing for about $5.8 million in the budget year to fund additional social work activity related to the child and family teams, and to fund at our current social worker costs, not the year 2000 social worker costs, the social work activity associated with changing the resource family approval process. With respect to rates, I would align my comments to the rest. There's a lot to dig into. We haven't had the opportunity to do that. We have concerns about adequacy like the previous witnesses, and we look forward to a process to work with the administration and the legislature to be able to recommend adjustments.
Thank you.
Hi, Susanna Niffen with Children Now. Similar to the comments before me, I just want to say thank you to the department. We've moved such a long way in the last few years since CCR started. Creating a system of rates that is based on the needs of a child is revolutionary and amazing here in California. We're definitely on the right track. Equity for relatives, all of these things. I did want to along with everyone else, say we're not sure about the adequacy of the rates, and we're not sure that the level of care system is correct. For example, we think children in level of care 1 definitely still need some supports and services dollars, so we'd like to see that change. But the department has been amazing at hearing the concerns of advocates, responding to those concerns in a positive way, and so we're really excited about going forward and fixing some of these minor details.
Thank you.
Good morning, Mr. Chair and members. Danielle Sanchez on behalf of the Chief Probation Officers. We appreciate and support the administration's investment into these county resources and into probation. I want to thank the director and his team for being great partners in this. We've done a lot of working groups and continue to do so along the way, and so our appreciation to you all for that. I would note, as other speakers had said, policy development in many of these areas still is underway, and so it's a little bit early to kind of know the true costs of local implementation. But we look forward to continuing those discussions as it pertains to the rates. Certainly, I think more time is needed kind of on all fronts to really take a deeper dive into that to ensure they are adequate to achieve the collective outcomes that we all want to see for these children. So we look forward to those discussions and support the administration's proposal toward this end. Thank you.
Thank you. Any additional public comment? Seeing none, we would say that we know that there is a work group process for vetting some of the concerns for additional work that needs to happen, and we'll stand by and continue to watch and monitor that progress. And we appreciate your work, and Mr. Director, and your team on that process. We're going to temporarily move pass issue number 2. Due to committee constraints, we're going to move straight to issue number 3. The issue is child near fatalities reporting and disclosure. Just to frame it a little bit, what's at issue here is we know that there is nothing more sad than seeing a child lose their life, and certainly one that we hope could be prevented when it occurs with abuse and neglect. Today, you'll hear the department outline measures that it wishes to have adopted that will allow the state of California to be in compliance with federal government requirements around child abuse reporting when there is a near fatality. There is funding tied to this reporting, and there is a deadline. And so, as a result, these new guidelines, these proposed guidelines, are being vetted before this committee. But what's really at stake are issues around transparency and, most important, keeping children safe. And I'm urging that we make that the lens through which we have this conversation today and throughout the entire budget process. Having said that, we will begin to hear from the department as they frame the issue and then take questions and comments from committee members and public comment.